It is 2 in the morning. You wake again, not because of noise, not because of a bad dream, but because your bladder will not let you rest. You shuffle to the bathroom. You sit down or stand there, tired. The stream is weak. It takes longer than it should. When you return to bed, your eyes stay open. Minutes turn into hours. This is the reality for many men after 50. The prostate grows larger with age. When it presses on the bladder or the urethra, nighttime urination begins. Some men get up 2 times, some 4 times, some even more, and each trip costs you more than sleep. It steals your energy the next morning. It robs you of confidence. It makes you feel older than you really are. Here is the good news. You do not have to accept this as just getting old. Natural adjustments, simple, practical steps, can help you rest through the night without heavy medication, without risky surgery. In this video, I will share 3 natural fixes. They are backed by science. They are realistic for everyday life. Fix number 1 teaches your body when to release water so you enter bed lighter. Fix number 2 calms the pelvic floor and nerves so you can empty fully once, not 5 times. And fix number 3 brings foods and habits that make your bladder quieter, your prostate calmer. Stay with me to the end, because the 3rd fix is the one most men overlook, yet it often makes the biggest difference. Tonight, you can imagine one thing: closing your eyes at midnight, waking at sunrise, rested, strong, and free. Hello, I'm Dr. Mary Wilson. For years, I've helped men and families navigate the changes that come after 50. And one of the most common struggles I hear is this: I just want to sleep through the night. If that's you, please know you are not alone. Millions of men face the same frustration, and there are safe, natural ways to ease the problem. Before we dive deeper, let me gently remind you, this video is for education. It does not replace medical advice. If you notice blood in your urine, pain, fever, or sudden worsening, please speak with your own doctor right away. Now, I'd love to hear from you. How many times do you wake up at night? Is it once, twice, or more? Share your number in the comments. It helps you feel heard, and it helps other men realize they are not alone in this journey. If you find value here, consider subscribing. That way, you'll never miss a simple, senior-friendly tip to protect your prostate and your sleep. Together, we can take small steps that bring back restful nights. Why does the prostate matter so much at night? After 50, this small gland often begins to enlarge. Doctors call it BPH, benign prostatic hyperplasia. It is not cancer, but it does press on the urethra, the narrow tube that carries urine. When the urethra is squeezed, urine flow slows. You may not empty the bladder fully. That leftover urine becomes the reason you wake again and again. There are several common drivers. 1, incomplete emptying. Even after you finish, a small pool remains. Within an hour or 2, your bladder feels full again. 2, nighttime fluid shift. During the day, fluid collects in the legs. When you lie down, that fluid returns to the bloodstream, then to the kidneys. The kidneys make more urine at night. Your bladder fills faster. 3rd, bladder irritation. Caffeine, alcohol, fizzy drinks, spicy or acidic foods all make the bladder twitchy. At night, even a small amount of irritation wakes you. 4, stress and pelvic tension. The more you worry, the tighter your pelvic floor becomes. A tight pelvic floor can trap urine and mimic the feeling of urgency. Put these together, and you get the perfect storm: weak stream, frequent urges, interrupted rest. The result is not just fatigue, it is higher blood pressure, poor memory, lower mood, even higher fall risk if you stumble in the dark. The good news? Each driver has a natural fix. We can lighten the load before bed, we can calm the bladder, we can restore better flow. Let's start with the first fix: resetting evening fluids so your bladder is quieter at night. Fix number 1, evening fluid and edema reset. Release at the right time, stay dry at night. Picture this. It is 9 o'clock at night, you are ready for bed, but as soon as you lie down, your bladder speaks up. You just used the bathroom an hour ago. Still, the urge comes again. Many men over 50 know this routine. The bladder fills quickly after bedtime, and it feels unfair. You did not even drink that much water in the evening. Here's what is happening. During the day, fluid slowly collects in your legs and ankles. You may notice swelling in your socks or shoes. When you lie down at night, that fluid moves back into circulation. Your kidneys suddenly get a flood of liquid to filter. They respond by making more urine. Your bladder fills faster than expected. Add to this another layer, irritants, that evening cup of coffee, a glass of wine or beer, soda with bubbles, even spicy or acidic foods like tomatoes, citrus, or chili, all can make the bladder more sensitive. So even a small amount of urine triggers a strong urge. The result? Multiple trips to the bathroom, interrupted sleep, and a body that never truly rests. This is why evening management matters. By controlling when and how the body releases fluid, you can enter bed lighter. And you can give your bladder the best chance to stay quiet until morning. Think of your body as a system of pipes and reservoirs. All day long, gravity pulls water into your legs and feet. That is why ankles often look swollen by late afternoon. When you lie down at night, gravity changes. The fluid in your legs flows back into the bloodstream. Your heart pumps it toward the kidneys. The kidneys, doing their job, filter that fluid into urine, and suddenly the bladder fills, right when you want to sleep. This pattern is called nocturnal diuresis. It explains why men who barely drink in the evening still run to the bathroom at night. Now add the prostate. An enlarged prostate narrows the urethra. Urine flow slows. You may not empty fully before bed. Even a small leftover amount can make the bladder signal full again within an hour or two. Bladder irritants worsen the story. Caffeine stimulates the bladder wall. Alcohol acts as a diuretic, pulling more fluid into the urine. Carbonated drinks and spicy or acidic foods trigger nerve endings in the bladder lining. So two forces combine: extra fluid from your legs, a bladder more irritable and less efficient at emptying. The result is what men describe as the endless cycle. Empty, lie down, get up again, and repeat. Understanding this cycle is the first step. Once you see the pattern, you can begin to shift it, naturally, safely, at home. The goal is simple. Enter bed with less fluid in your system and a bladder that is calm. Here are proven habits you can try. 1. Front load your fluids. Drink most of your water earlier in the day. Keep sipping through the morning and early afternoon. By evening, taper off. After 6 to 7 p.m., cut fluids sharply. Give your body a 2 to 3 hour dry window before sleep. 2. Release fluid from the legs. If your ankles swell, elevate your legs for 20 to 30 minutes in the late afternoon. Gravity will push extra fluid back into circulation while you are still awake. Some men also benefit from light compression socks during the day. 3. Double void before bed. Go to the bathroom once. Wait 30 to 60 seconds. Relax, then go again. This helps empty the bladder more completely. 4. Avoid irritants in the evening. Skip caffeine, alcohol, carbonated drinks, and heavy spicy or acidic foods after dinner. They make the bladder jumpy. 5. Warm the body. A warm shower or a 10-minute foot soak before bed relaxes muscles and eases bladder tension. These steps are not dramatic, but together they shift the balance. You enter bed lighter, your bladder rests easier, and you set the stage for a quieter night. Not every man is the same. If you take diuretics for blood pressure, ask your doctor about moving the dose earlier in the day. If you use antihistamines or decongestants at night, know they can make it harder to empty the bladder. Men with heart or kidney disease should never change fluid intake without guidance. Remember, the aim is not to dehydrate you. It is to manage timing. Drink enough, but shift most of it earlier. Now, what if you do all this? yet still feel the urge every hour. Often the problem is not fluid alone. It is the pelvic floor and nerves holding too much tension. That brings us to fix number 2, pelvic floor and nerve. Calm. Empty fully. Sleep longer. Imagine sitting on the toilet late at night. You feel the urge. You try to push, but the harder you push, the weaker the stream becomes. This is a common cycle. When the prostate is enlarged, men often strain, but straining makes the pelvic floor muscles tighten. A tight pelvic floor acts like a fist around the bladder outlet. Instead of helping, it blocks the flow. Stress adds fuel to the fire. When you worry about waking again, the body tenses even more. The nervous system shifts into alert mode. The bladder becomes jumpy, sending false signals of urgency. So the problem is not always too much urine. Sometimes it is the muscles and nerves refusing to relax. That is why calming the pelvic floor before bed can be a powerful natural fix. The pelvic floor is a group of muscles at the base of the pelvis. They support the bladder, prostate, and rectum. They also control the opening and closing of the urethra. When these muscles are balanced, they tighten at the right time and release at the right time. You feel a steady stream, and the bladder empties more fully. But with age, stress, or long-term straining, the pelvic floor can stay partly clenched. Think of a hand gripping too tightly. This creates two problems. The bladder does not empty completely. Nerve signals become confused, sending frequent urges even when little urine is present. The nervous system plays a role too. Stress activates the sympathetic system, your body's fight or flight. That response makes pelvic muscles tighten even more. At night, lying in bed, small urges feel urgent. You get up, only to pass a small amount. Research shows that gentle pelvic floor relaxation can reduce nighttime trips by improving bladder emptying. It is not about force. It is about teaching the body to let go. The takeaway: calming these muscles and calming the nerves that control them can break the cycle. Less straining, more complete emptying, and fewer false alarms that steal your sleep. Here is a simple 6 to 8 minute routine you can do each evening. It requires no equipment, only a quiet space. 1. Belly breathing, 2 minutes. Sit or lie comfortably. Place a hand on your stomach. Inhale gently for 4 counts, letting the belly rise. Exhale slowly for 6 counts, letting the belly fall. This signals the nervous system to shift from fight or flight to rest and digest. 2. Relaxed Kegels, 2 to 3 minutes. Most men have heard of Kegels as tightening, but here the focus is on the release. Tighten gently for 2 seconds, then let go completely for 8 to 10 seconds. Feel the drop, the softening. Repeat 5 to 6 cycles. 3. Hip stretches, 2 minutes. Lie on your back. Cross one ankle over the opposite knee, the figure 4. Hold for 30 to 45 seconds each side, or hug one knee toward the chest, then switch. This reduces tension in the hips and pelvic floor. 4. Toilet position, 1 to 2 minutes. When you urinate, place a small stool under your feet. Lean forward slightly. Relax the shoulders, jaw, and belly. Avoid pushing. Instead, let gravity and relaxation do the work. This short routine, done consistently, helps the bladder empty more fully. And with less leftover urine, you can rest longer before the next urge. Every man's body is different. If you feel pain in the pelvis, burning with urination, blood in the urine, or fever, stop the exercises and see your doctor. Those signs can point to infection or more serious problems. For most men, this routine should feel gentle and calming. If any movement causes sharp pain, adjust or skip it. Remember, the goal is release, not force. When practiced nightly, these small steps teach the body to let go. The bladder empties more fully. The urges calm down. But what if your bladder still feels jumpy, even with relaxed muscles? That is often the role of diet and inflammation. This leads us to fix number 3, prostate-friendly eating and plant nutrients. Feed calm, sleep deep. You finish dinner. The meal tasted good. But hours later, your bladder feels restless. You lie in bed and the urge comes back. For many men, the problem is not just fluid or tight muscles, it is what you eat and drink before bed. Spicy chili, tangy citrus, or tomato sauce can irritate the bladder lining. Carbonated drinks, even sparkling water, create pressure that triggers urgency. Salty foods at night pull extra water into the bloodstream, forcing the kidneys to make more urine. An enlarged prostate is already sensitive. Add bladder irritants, and the signals get louder. Even a small amount of urine can feel urgent. That is why smart eating, especially in the second half of the day, is so important. The right choices calm the bladder, they soothe prostate tissue, and they reduce nighttime trips to the bathroom. The prostate and bladder share a delicate neighborhood. When the prostate enlarges, tissues become more sensitive to irritation. Food and drink can either soothe or inflame that area. 1. Inflammation in prostate tissue. High salt or heavily processed foods promote low-level inflammation. That swelling adds to the pressure already caused by enlargement. Anti-inflammatory nutrients like lycopene from cooked tomatoes, omega-3s from fish, and zinc from pumpkin seeds help reduce irritation. 2. Bladder sensitivity. The bladder lining reacts strongly to certain triggers. Caffeine stimulates muscle contractions. Alcohol pulls water into the urine and irritates the lining. Acidic fruits and sauces increase nerve sensitivity. By removing or limiting these in the evening, you give the bladder a calmer night. 3. Fluid and sodium balance. Eating salty meals late pulls fluid into circulation. The kidneys must work harder at night, producing more urine. A lighter, lower sodium dinner means less work for your bladder at midnight. 4. Plant nutrients for balance. Foods rich in phytosterols such as pumpkin seeds, walnuts, and soy support prostate health by gently modulating hormone activity. These natural compounds may help reduce urinary symptoms over time. The bottom line? When evening meals are cleaner, calmer, and richer in plant nutrients, the prostate and bladder send fewer false alarms. This means fewer trips to the bathroom and more hours of uninterrupted sleep. Think of your day as divided into 2 halves. The first half is for fueling, the second half is for calming. Morning and midday. This is the time for bigger meals and stronger flavors. Enjoy protein, eggs, fish, or lean poultry. Add whole grains and colorful vegetables. If you like citrus, coffee, or spicy foods, take them earlier in the day when the bladder can handle them better. Afternoon into evening, shift to lighter, calmer foods. Dinner. Aim for a smaller plate, eaten at least 3 hours before bed. Include leafy greens, steamed or roasted vegetables, and a modest serving of protein. Keep the seasoning gentle. Limit salt. Choose herbs or olive oil for flavor instead of heavy sauces. Avoid irritants. Skip late caffeine, alcohol, and sodas. Smart carbs. A small baked potato, brown rice, or oats can steady blood sugar and help you feel satisfied. Snack options. If you need a light snack in the evening, choose foods that calm, a handful of pumpkin seeds or walnuts, a small bowl of plain yogurt with ground flaxseed, warm chamomile tea, or simply warm water instead of coffee or soda. These simple swaps do not require extreme dieting. They simply shift your body into a calmer state before sleep. Your bladder rests, your prostate feels less irritated, and you set yourself up for fewer nighttime interruptions. Every man's body responds differently. If you notice burning, blood in the urine, fever, or sudden worsening of symptoms, see your doctor right away. Those are red flags that go beyond simple diet changes. For most men, the goal is steady habits, not perfection. Choose smaller, calmer dinners. Use plant nutrients like pumpkin seeds, walnuts, or cooked tomatoes during the day. Skip late caffeine, alcohol, and salty meals. Supplements such as saw palmetto or plant sterols may help some men, but results are mixed. Always check with your physician before adding them, especially if you already take prostate medications. With the 3 fixes combined, fluid timing, pelvic relaxation, and prostate-friendly eating, You give your body its best chance at restful nights. Now, let's recap the simple steps you can begin tonight. Let's bring it all together. Here are the key steps to begin tonight. Shift fluids earlier. Drink more in the morning and afternoon. Taper after 6 to 7 p.m. Create a dry window. Give your body 2 to 3 hours with minimal drinking before bed. Empty fully. Use the double void method. Go, wait, relax, and go again. Calm the pelvic floor. Practice belly breathing, relaxed Kegels, and gentle hip stretches each evening. Improve toilet posture. Feet on a small stool, shoulders loose, no straining. Choose calming foods. Light, low-salt dinners. Skip late caffeine, alcohol, or spicy meals. Add plant nutrients, pumpkin seeds, walnuts, and leafy greens during the day. Small steps, done daily, can bring longer stretches of sleep and calmer nights. Imagine tonight. You follow a few small steps. You cut fluids after dinner. You stretch, breathe, and relax your body. You sit down to a calmer meal. And for the first time in weeks, you wake only once, or maybe not at all. This is not a miracle. It is balance. Your bladder feels lighter, your nerves calmer, your prostate less irritated, and your mind finally at peace. Restful sleep is not only about comfort, it is about safety, memory, mood, and energy for tomorrow. When you rise after a full night, you carry yourself differently. You walk steadier, you think clearer. You feel more like yourself again. So here is your next step. Try one change tonight. Leave a comment below. Which fix will you start with? Fluids, relaxation, or food? Your story may encourage another man. If this video helped, please like it. Subscribe for more senior-friendly guidance to protect your prostate and your nights. And join me next time as we uncover the morning mistakes that silently worsen nighttime urination and how to avoid them. Sleep deeply. You deserve it.